Hello, everybody. A message from Dr. Gaboni QHSC Incorporated. My name is Dr. Haiti Gaboni Marupindi. Happy holiday, everybody. I am here to give you a message from the organization. The message is based on two parts. The first part is to say thank you for the ongoing support for this organization. And the second part is the year-end summary of what we've been doing in 2019. So this year we are so grateful to God and for you, for your support that enabled us to accomplish the 2019 Dodoma Medical Mission in Tanzania that took place on September 18 to October 2nd. And this mission took place at Dodoma Christian Medical Center. This was a pilot medical mission, and which was comprised of a group of 5 volunteers, including 2 nursing professors from South University, myself included, and Dr. Sharon Ramjon, 1 elementary school teacher who was Mrs. Christine Behuniak, 1 administrator, Mrs. Kay Holster, and 1 osteopathic medical doctor, Dr. Anna Marie. So at Dodoma Christian Medical Center, every morning they have a morning prayer. So all the nurses and doctors, before they start their working duties, then they go outside with the patients who are waiting outside, and the patients who are ambulatory will come outside and pray together before they start their day. So that was a very great start of the morning. The purpose of the medical mission was to provide education and training to the nursing and medical staff, was also to improve nursing clinical practices, and also to ensure patient safety by collaborating with the medical staff at Dodoma Medical Center. So another goal to this mission was to provide preventative dental hygiene education and effective hand washing technique. This training was done to the children who were from grade 1 to 4. And the goal was to prevent the spread of infectious disease at Ntuka Primary School. So the mission was partnered with Village to Village Care Incorporated, and this is located in New York State. And both our goals to assist in caring for vulnerable population. So this was the 3rd outreach to Dodoma. And prior visit, I went by myself to be able just to learn what is there so we can go and try to work together and address the challenges. So in 2007, I went and conducted educational need assessment to the hospital staff and identify knowledge gap and clinical skills deficit. So from that, I learned and we came back and we prepare the onboarding process training. So I went back and did that with the nursing at the Dodoma Medical Center to try and educate the nurses and the doctors for what the expectations of their role at the hospital. Knowing that by myself was not going to be enough, so then we went back to the 3rd mission, which was the pilot going with other people, and we had specific purposes to go there and do the training for all that we needed to identify. So our purpose was met because we did all this number of training you can see on the chart. The first column is identify the specific training we did. For example, neonatal resuscitation. We did it with 34 nurses and doctors, and those are how many minutes we spent, and which was the total of hours we spent teaching that class was 25. And then the second one was chest compression technique, and that was 32 people who attended the class, and those are the minutes that was allotted there, and total of 24 hours. And then so the rest of the activities divided like that. So you can see the last 2 was done at the school. So as I said, these are the grade students from 1 to 4. And then we are able to work with 900 students, teaching them hand washing and dental hygiene. And these are the pictures just depicting some areas that we were doing the training. And you can see some training on the neonatal resuscitation. And then another one is the CPR, another one was the hand washing, and the kids were attentively listening to the techniques of how to wash their hands and how often should they brush their teeth. So with every mission, it's very important to have enough supplies to go and work and provide care to the patients. So we did fundraising, and we asked for donation for different places, and people did respond and provided us with the great, a lot of supplies. So this is just maybe 1/10 of the supplies that was donated, and I thank you everybody for doing that part. For example, we had the adult mannequin, which was provided by Professor Ramjan, and we had all those other monetary donations, which we end up buying some of the supplies that were needed for the hospitals. We had dentists who provided toothpaste for the children at school, so we were able to provide them and show them how to do that. So in order to, if you're interested to learn all the list, or you're wondering what you can donate, so you can go at the website there and provide, there's a complete list of all the things that we would like to donate, to collect for the next mission. So without the donation, without this collection, without this fundraising, the mission would have not been possible. So I always say thank you again for ongoing financial support on the donated supplies from family members, donors like you, colleagues from South University, and the Facebook friends. And all these donations, some of them pass through GoFundMe, Cash App, and PayPal, and some people use the personal checks. So I continue saying thank you. Whether for your support financially or your expertise. If you try to volunteer, we welcome all of you. And then so all this donation help us to improve in nursing and medical staff competence by providing all those training that I listed before. And those training cannot be accomplished without the equipment. So the donation we get, if it's the money, then we go and buy those equipment and go and use it for training. In addition, all those also donated things, we had to go to the community outreach activity, which is one of the school. So we were able to go and give those toothpaste, and teach the students and be able to make all those first aid kit for the students of 1,400 who did not have any of the first aid kits. So all these donations, when you give us, it helps us to go and provide care. And of course, do all this training that our ultimate goal is to reduce the spread of infectious diseases at the schools. So some of the things that were donated, I mean, is depicted on the pictures here, and the ways that we were able to collect this money, our donations, is through the Cash App, GoFundMe, and the checks. Again, thank you for all your donations. And so I also want to thank you, the volunteers that I went with, so for your time and expertise and the love of the people to Tanzania. Without you, this mission, the pilot mission, would have never been possible. So thank you, and thank you, and thank you again. And also I want to thank the DCMC for allowing us to come and provide services to staff and patients. So moving forward, the medical mission will operate under Dr. Gaboni QHSC Incorporated, and QHSC means is Quality Healthcare Solutions and Consulting. And this is, we're in the final process of registering this organization as a non-for-profit organization. So I continue again, I welcome and for all your support for future missions. And please go to the website and sign up. So every time we have an update, then I can share you what we're going to do, what type of project we're going to do. And if you're interested to come and join us, I would really appreciate when you do that. So for the next mission, we are thinking of going to Dodoma, and there is all these locations are in Tanzania. And the possible dates will be September 14 and to October 3rd. Those dates are tentative in the sense that it depends on when we get the tickets and which airline is available for us, and how economically we can get to that airline, and how many seats we can get to that flight. So it may be the 13th or maybe the 15th, but it's always at least between maybe a day before, a day after on those proposed dates. But we know ahead of time when you're making those arrangements. So then if you need to get time off from work, then you know you have plenty of time to confirm those dates. So I will encourage you, again, go to the website and register for the updates, and then we can let you know. So, but if your expertise or credentials are not listed here and you're still interested in volunteering, just go to the website, read through it, and sign up, and then ask that question. Then we can address for one-on-one to make sure if you're interested, we can find something for you to come and do it. Because I welcome anybody who is passionate to volunteer or pay back to the society. We always welcome. Our goal is to get at least 20 people for the next trip. because we do identify that there's a lot of need. So the more people we get, the more impact we can have to these communities. And so we are looking for physicians, nurses, any types of medical and healthcare field, and also for volunteers. I mean, I can say we can use teachers, administrators, social worker, public health pharmacists, anybody. Please come and join us. And just go and log into the website or send me the email. Again, my contact information is right there. And as I said, I take this special opportunity from the, Dr. Gaboni QHSC Incorporated. Thank you and happy holidays, and have a very, very Merry New Year.